this bill are actually different right now. That's why it's so important that we're here today to educate some of these lawmakers in order to make sure they take what's good on the one side and keep it on the other, and what's bad on the one side and get rid of it. And where it's missing, that's where we have work to do as well. We need to get the champions to get behind some of these critical amendments. And women control prevention is one of them. In the Senate bill, we have basically inclusion of something called the Microbicides Development Act in the Senate version of PEPFAR. That's excellent. That's really good. But in the House bill, it's not there at all. So this is something that some people certainly will be working on over the next couple of days to try to see if we can kind of climb up that hill as well.
Women who are most vulnerable. Women who are sold into sex trade. Children who are forced into child marriages. And all these people who need the resources, who need support, are left out of these programs. Violence against women is a consequence and also the cause for HIV/AIDS. And PEPFAR ignores that, the deep connection between the lives of the women and HIV/AIDS, especially relating to women of color and HIV. One of every 3 women at some point of their lives will face violence of some sort or other. Rape, beaten, sold into marriage, domestic servitude, or subjected to harmful practices such as female genital mutilation.
There's been people like Paul Farmer who've gone to the most impoverished places in the world and have shown that he can provide better health care in Haiti or Rwanda than people are able to provide in downtown Detroit. And I challenge you guys to dream, to close your eyes and think of a time where there are going to be people in sub-Saharan Africa who are going to get health care just like the people who live and work in that building. And that's what you guys should think about. And I'm going to hold this key up here, and it says healthcare workers. Because you know what? There's some problems with PEPFAR. There's some problems that we can address this time around.
Right.
PEPFAR is an emergency plan for AIDS relief. But let me tell you, while the emergency is still going on, we need to think about sustainability. This isn't just an ambulance coming in. The building is still on fire, but we need to think about how we're going to rebuild that building. And no matter how many ARVs you ship over there, no matter how many generic drugs you can bring, you need to deliver that care. And we know there's an opportunity to provide over 450,000 healthcare workers to Africa.
Yeah!
We live in the richest country. A third of the global economy flows through this country. So it would make sense that a third of those healthcare professionals should come through PEPFAR, right? So when you look at these keys and you ask yourself, we're going to unlock that door to AIDS treatment. Right now, if we unlock that door, there's a lot of treatment, but there's nobody in that room. Those people aren't there. The healthcare workers, the healthcare professionals, the nurses, the midwives. A friend of ours just came back from Burundi. 7 million people in Africa. How many physicians do you think they have in Burundi? 300 for 7 million people. You can have warehouses full of drugs. Who's gonna provide that care? So we have an opportunity to tell Congress, not only do they need to pony up our fair share of those healthcare workers, but we need to make sure that they're healthcare professionals.
Yeah.
They need to be sustainable, and you know what? They need to come from the places that they're treating. The United States, I'll tell you a dirty secret. 1/4 of all of our physicians are imported.
Yeah.
We need to and we need to invest in those countries so those providers don't see the opportunities in America. And you know what? They don't want to leave. They don't want to leave their homes. They want to stay with their families. Anybody who's left their family, it is a hard choice. And we need to invest in those providers and give them the resources, the salaries, the nurses, the midwives, and especially the AIDS treatment that they need to take care of those people.
Yeah.
We have a duty. What do we want? We want PEPFAR reform, but when do we want it?
Now!
What do we want?
PEPFAR reform!
When do we want it?
Now!
PEPFAR funding needs to explicitly target the most vulnerable people: women, drug users, sex workers, men who have sex with men. In the U.S., it would be laughable to have an HIV program that excludes services to sex workers or drug users. People in other countries deserve the same standards of care. Current law, PEPFAR requires that
all prevention funding be set aside for abstinence until marriage programming. In the reauthorization bills, the Office of the Global AIDS Coordinator must report to Congress if less than 50% of prevention funding is spent on abstinence and fidelity programming in a given country with a generalized epidemic. Congress may call this a compromise, but I call this a defeat for the people who are working hardest to fight AIDS around the world. While a reporting requirement may not seem as serious as a hard earmark, in practice it will have the same negative effects as one. Earmarks such as these have been proven to confuse people on the ground as working to fight the HIV/AIDS pandemic. What are they allowed to say? Where's the line between taboo and acceptable when seeking to educate the population? Moreover than this, it goes against the proven ABC method of HIV prevention, abstain, be faithful, and condom use. Leaving a third of the program out results in an ineffective, unrealistic approach to fighting the HIV/AIDS epidemic worldwide. Finally, the PEPFAR reauthorization bills do not take the steps needed towards integrating HIV/AIDS and family planning programs. Keeping these programs separate further prevents the establishment of a comprehensive response to the HIV pandemic. Family planning and reproductive health workers are often the first responders for HIV-positive women and young people. The Senate bill will take out any language regarding family planning at all, and the House will take a step back, subjecting HIV programmers to the harmful global-gag-rule. Currently, the global-gag-rule applies to international family planning programs that receive money from the U.S. It prevents them from mentioning, much less providing, abortions. Applying this to HIV/AIDS implementers as well would further tie free speech and would be yet another restriction to confuse those on the ground. These politicized policies in PEPFAR reauthorization bills may be compromises, but they are living in a dreamland. Prevention policies that tie the tongues and hands of implementers are ineffective and unrealistic.